this last presentation for this august but limited body is all about the neurotransmitters that are part of it. Because I did it yesterday, Wednesday afternoon. And I'm going to pick up kind of where we left off as soon as I sort of scroll down to that area. And this is really the starting point. You can see there's not a whole lot left slides-wise with this. But this is really the important part, because effectively there's so many different medications and so many different things, and it really is an understanding of why we use why we use epinephrine. You know, why we want to use certain medications to address certain situations, to understand it. So a lot of them work their way through this. And there's some names you're going to have to become very familiar with going forward. So, and I was looking at it too. It's interesting. I mean, a book that I'm reading now, fiction, is talking all about neurotransmitters and the role that they play in certain types of consciousness and things like that. It's very interesting. It's the most recent Dan Brown novel. And he does a lot of research. It probably took him 2 or 3 years to come out with this one. He was famous over the last 20 years because he wrote the Da Vinci Code and things to follow up after that. So it's a very, very interesting. I always agree with his premises. He seems to be very anti-religion in a lot of ways, which I don't really approve of. But he's a good writer. Nevertheless, this is all about the neurotransmitters. So we know the system basically revolves around acetylcholine and norepinephrine, and the epinephrine, if it makes its way through the sympathetic nerve, through the some subtleties when we look at their effects on blood pressure and heart rate that you address later, most likely in AP2, I would anticipate, that are there. And there's a lot of interesting nuances with that as well. So the name we give, and we use them all the time, are cholinergic and adrenergic. And we actually name receptors, particularly after the adrenergic ones, and classify them, because it's not so much the neurotransmitter. That just identifies what the nerve's producing, acetylcholine or norepinephrine. It doesn't identify what kind of receptor it is, but that's what we're coming to. So again, norepinephrine, with the exception of the one going to the sweat glands, is the one that's given off in what they call the postganglionic, or the second nerve, in the sympathetic nervous system, with that one exception. Remember exceptions. So the effects depend on the receptor. They show you the same diagram, and that's fine. These are names that are used more often in the context of a research type context. Just making sure I turned on the recording. Yeah, I did. One of those rapid mornings. And so it's just, we use these more to understand, but they're terms you're going to hear. And it kind of underscores some of the effects, particularly of nicotine. So when cholinergic receptors are classified as either nicotinics or muscarinics, all of the preganglionic fibers release acetylcholine. All of those ganglia, by definition, are nicotinic receptors. So, and we do this because when tobacco came over to Europe, where they're beginning to study the effects on tobacco, because we really didn't have the facilities in the New World, they were able to extract it, and chemists were able to identify what nicotine did, what nicotine was, isolate the chemical, and found that it produced the same results, as stimulating those receptors. So they classified them by this magical compound called nicotine. Hence the name nicotinic receptors. You should remember that. They found a mushroom poison, because many species of mushroom are poisonous to us, and they've extracted it. And if you like mushrooms, don't go grab the ones in your yard. If you forage for mushrooms, make sure you're with somebody who knows what the heck they're doing. It's very interesting stuff, by the way. Mushrooms are very, very interesting in that regard. Nevertheless, they had isolated a poison from mushroom, and they have found that the receptors of the postganglionic receptors in the parasympathetic system were responded to this, and it is the same effect. So that's the name of the classification. Nothing really special about that. Nicotinics and muscarinics. It's more of a general type question. What are the different kinds of cholinergic receptors? Nicotinic receptors, muscarinic receptors, neither, both, that kind of a question is one that potentially would be on the test. So the nicotinics on all postganglionic nerves, sympathetic or parasympathetic, in the adrenal medulla, and it's really the same receptor that we see at the neuromuscular junction, to be fancy about it. So I'm not going to ask you about it. It's always stimulatory. It works fast. Whenever you open ion channels, that works fast. Okay. The muscaриnic's different. All the effector cells by the postganglionic cholinergic fibers. Okay. So the effect of acetylcholine at muscarinic receptors, and this is a big exception, either inhibitory or excitatory. This is definitely on the test. Binding of acetylcholine to cardiac muscle doesn't make it go faster, it makes it go slower. That's extraordinarily important. Okay? Extraordinarily important, because our heart rate is governed. It's held in check, just like the cell cycle. It's held in check by the vagus nerve. The healthier you are, the more the vagus nerve keeps that heart rate controlled. So for those of us who are here and sitting here comfortably, effectively what it means is my heart's at rest, and if I'm healthy, it should be somewhere between 60 and 80 beats. Athletes maybe a little bit lower, typically. Young people, typically this. If you have something more than that, that's basically what's going on. Let me just do a quick. Okay. Let me give that an okay. Stop texting. So for me, when I was very unhealthy, I had a resting heart rate of over 100. It's bad. Now it's right where it's supposed to be, in that 60 to 80 region. So for all of you, these are the things that catch up onto you, particularly as you get older. Bad habits, things that you do, substances, alcohol, very, very commonly. All of these things can have an adverse effect. So I urge you, don't make the same kind of mistakes that I did. So binding acetylcholine to cardiac muscle cells slows the heart rate. What you're going to see is epinephrine, or rather norepinephrine or epinephrine. What they do is not only do they accelerate the heart rate, they increase the force of contraction. When you go into heart, and you'll learn a little bit about this in AP2, the fancy name we give for lowering for just controlling the heart rate is chronotropic. Chronos, CHRONOS, means time. And you're going to see that it's a little different. The vagus nerve in the parasympathetic system is all about heart rate and lowering it. Epinephrine and norepinephrine accelerate, and they accelerate the force of contraction. So they really get the heart. That's why when somebody is in an emergency, when there's a code and they're flat line, you can't shock them unless there's a rhythm. They have to have some heart activity. So how do they stimulate heart activity? They give them a shot of epinephrine, typically right into the heart. Intracardiac injection. I mean, it's because you can't fix the heart unless you know what's wrong with it. So getting one of those defibrillators in a flat line, that's not something you can defibrillate. Okay, so it's pretty extreme stuff, but that's why it's a lot of times that precordial thump that you use. I don't know if they still use it. They pound the chest once or twice to start. Sometimes that'll start the heart. So that's why you do it. You're sort of generating electrical activity. I haven't re-upped in 25 years for CPR, so you guys should be more current than I am. And you will be here. They offer the course all the time. Up in nursing, they were doing. Anybody take that this time around? My buddy Hannah was probably giving the course. Did you meet Hannah yet? Tell her you're a friend of mine. You'll be okay. Okay. These are the norepinephrine receptors, and this is going to explain about the heart, and it's going to explain why we use an EpiPen. So we have two types of receptors, alphas and betas. We classify them alpha 1 and alpha 2, betas 1, 2, and 3. The effects depend on which category. They're all what we call subclasses. Norepinephrine, released by the sympathetic nervous system in fight or flight on your heart, triggers beta 1 receptors. They cause an increase in the heart rate and also the force of contraction. So they didn't put that in here. Whereas epinephrine causes the bronchi to dilate. Remember, fight or flight. Eyes wide open, breathing rapidly, but in order to breathe rapidly and to deliver a lot of air to your lungs because your heart's racing and your muscles are pumping, you have to have the bronchioles, all the air passageways have to be dilated. Those are beta 2 receptors. That's the EpiPen. Because the EpiPen will do the same thing. Epinephrine and norepinephrine basically work the same way. Subtle differences, as I said before. So when you jab somebody or you jab yourself with that EpiPen because of a bee sting or because of an acute asthmatic attack, it specifically is going to go to a number of places, but this is the reason, beta 2 receptors. So again, it's not excitatory, it's inhibitory. It's dilating those bronchiolar, those tiny microscopic air passageways and causing them to open up. Because what has happened when the release of a chemical called histamine, because of an allergic or an anaphylactic or a reaction to cold or excitement, has caused this histamine to be released. It has caused the bronchioles to spasm. The epinephrine is causing them to dilate. That's why the EpiPen works. And you can make the same argument with CPR, doing that then by giving them that. At least you know if you're going to have to ventilate somebody, it should get where it's going, assuming that you can survive, that they can survive. So there's a whole lot of science. So remember the exceptions. The fact that acetylcholine from the sympathetic nervous system goes to sweat glands. Remember the exception that the acetylcholine from the vagus nerve lowers the heart rate. The exception here, that epinephrine or norepinephrine going to beta 2 receptors dilate them. Think about what enables fight or flight. You're going to see a little summary that's too hard for me to read. Here are some of the things that are going on that will help you. Nicotinics or excitation. In most cases, the oddball is an inhibition of cardiac muscle from the muscarinics. Beta 1s, heart predominantly, heart rate and force of contraction. When you learn about kidneys, we'll learn about renin. Renin is something that helps your kidneys make sure that your blood pressure is maintained. Okay, your kidneys basically do it on their own. Kidneys very complicated. You get that in the last quarter of AP2. And I don't know how extensively they'll go into it. For me, it's always a challenge. I just finished teaching the anatomy. The physiology is a challenge. Beta 2, lungs and most other sympathetic target organs, blood vessels serving the heart, liver, and skeletal muscle. That's why in fight or flight, it targets what you need to have. You have to have you're going to have to make sure that your heart is pumping efficiently and it has adequate blood flow. This dilates those blood vessels to the specific areas that engage in fight or flight. You can triple the amount of blood flow to your heart. Okay, you can divert it to skeletal muscles that you need for fight or flight, and you increase it to the liver because the liver is going to break down glycogen, how we store carbohydrates. That's your emergency sugar supply, your energy supply for fight or flight. It's only going to last for a small period of time, but you survive because of it. Everybody should get that. Don't worry about beta 3s, alpha 1s, and alpha 2s. Virtually all sympathetic targets, especially blood vessels serving the skin, mucosa, abdominal viscera, and what they do is this is constricting. This is the mate to what the beta 2s are dilating to increase blood flow. This is where the blood's coming from, or where it's no longer going to, other than maybe just a little bit to keep the things functional. Okay, we want the blood flow to go into the heart and skeletal muscles. 5 to 10% of your blood goes to your skin ordinarily. The heat we're generating is a separate circuit. That's coming from the sweat glands. So blood flow is being reduced to the skin. reduced to the gastrointestinal tract, reduced to the kidney and the salivary glands. Remember, that's what we want to make sure that you have clear respiratory passageways. So, and then this involves the pancreas, and this is to a lesser extent, this involves like a subgroup of energy sources, if you want to think of it that way. So I'm not going to obviously ask you about that, but this is really important. These two really are where fight or flight does most of its work, and obviously keeping the heart going relatively rapidly and strongly. Okay? Examples. Nicotinic agents, the one we use are nicotine. And because nicotine itself is addictive, the reason nicotine patches work or nicotine gum, nicotine you can't swallow. The gum you're absorbing under the tongue in the abundance of blood vessels that are there. So they're being absorbed rapidly directly into the bloodstream. They can't go through the digestive tract. The acid would destroy it. That's why, and the patches are utilized for that. So what they're doing, it has a variety of different effects, including blood pressure rising, but basically it's about the addiction. So you feel kind of, I used them, they didn't work for me. But I mean, when a smoker has those on, particularly if they have not ceased smoking, I mean, your headaches, high blood pressure, types of things. It's really. Some people it works very effectively, some it doesn't. Mine it didn't work. I used something called Chantix, which I never would recommend, but it worked. I'm not. It's a tough one to tolerate. The side effects are not pleasant. I had dreams you can't even describe. I'm trying to drive here to work. I tell every class this. I'm in my car going, okay, Lou, you've got to make a right at the stop sign. Okay, Lou, stop at the stoplight. That kind of stuff. Your ability to focus. Imagine trying to teach or do any job. Moving on. So that's the nicotine and the smoking cessation packages. These are different. I don't see a lot of use. So again, look at the names. Sympathomimetic, parasympathomimetic, sympatholytic. I told you about that before. It's a fancy name. It means mimics, does the same thing. It mimics the parasympathetics, or it opposes or blocks the parasympathetics or the sympathetic. These are terms, when many of you get to pharmacology, they're going to talk about alpha 1s, beta 2s, beta 3s, sympathomimetics, sympatholytics, blah, 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 blah. Okay? That's why this is important to understand. So I can't emphasize that enough. Okay, so here, the muscarinic agents. Okay, we don't have, we have better things to use on the bladder. Okay, because particularly when people have prostate problems, it tends to make it very difficult to urinate. There's a chemical, I'm not sure how it works, called Flomax that has minimal side effects, because I used to take it. If you didn't know, I had prostate surgery because of a complication of my bladder cancer right around 4 years ago. And that was helping the medicine, but I don't have to take it anymore. And this is specifically for glaucoma, because that's going to open the drainage passageway. Glaucoma is a fluid pressure that you learn about when you learn about the eye. Okay, and we build up too much fluid in one of the chambers, okay, right behind the cornea and just in front of the lens. And it's got a little canal that allows us to drain out. That keeps the canal open. That's how that works. But that's more about the eye. So I'm not going to ask you about any of those. Pilocarpine or bethanacol. The same thing here. Okay, this is acetylcholinesterase inhibitors. That was on the previous exam. This is the bad stuff. Those are nerve gases, chemical weapons. Okay, so they got them from pesticides. That's where they came from back in the early 1900s, right before World War I. This is a treatment specifically for myasthenia gravis. I'm certainly not going to ask about that, and I already asked about that. But these are the acetylcholine, so they can be used for good. Here you're targeting specifically the neuromuscular junction in a way that makes it therapeutic. And now these are very significant sympathomimetics. My daughter figure skated for 7 years. By the last 3 to 4 years, she had cold-induced asthma, and it was complicated by exercise. And so they gave her, like, everybody knows somebody with with basically an inhaler. The inhalers are inevitably, typically albuterol or something similar to it. What it targets, okay, is sympathomimetic. It's not, it's been made to mimic the effects, enhances sympathetic activity, binding to the adrenergic receptors or increasing norepinephrine. That's how they work, and particularly for asthma. Why we use the EpiPen first, this works more, this augments it. Typically, someone with an EpiPen, that's so they can breathe and survive. After that, then they probably have an inhaler, and also maybe they'll take antihistamines because remember, histamine blocks it. You'll learn all about that kind of stuff going on, particularly in pharmacology. So she had an inhaler, and she had one for steroids also. I don't know if they still use it, but the steroids are anti-inflammatory, and what releases the histamine is an inflammatory process. She used them both. Now, when she stopped, skating, competitively skating, recreationally skating, not a problem. Because the last time she skated this was like '98 or '99. It's a long time ago comparatively. I think she was 14 or 15. It was here before we owned the rink. The lady who runs the figure skating program there. Did anybody meet her? Anybody go down there meet? Her name is Beth Sutton. We all just got an email from her because they're having their annual Christmas show. She was in the Ice Capades years and years ago. My daughter knows her very well. She was a coach when she started. Not her coach, but one of the coaches in the rinks program. So we know Beth very well. I keep threatening to go down there and say hi. So our asthma dilates. That's why that is. Phenylephrine is another one of these agents. For years, and it's still there. If you get like, you got a cold and you got NyQuil or Dayquil, they'll have, if you look on the ingredients, it has phenylephrine. That's a decongestant. It's in all the products. It's a relatively safe product. It acts a little bit because it's sort of a variant of epinephrine. You can see the name. They come from a parent compound. This is also significant historically. Before this, there was a compound called Sudafed or pseudoephedrine. Ephedrine was the first stuff that came from Chinese tea that amphetamines were made from. So the Sudafed, which was perfectly legal and may even still be, but it got to the point where it was controlled because people were using it to make amphetamines. They were using it. They did a whole program about that on AMC called Breaking Bad, about somebody who was a scientist who basically, I don't know what did. I never really saw the show. It was very popular. Literally was someplace out in the desert making speed, and they just illicit drugs and selling them. I mean, it's not that complicated a reaction. It's not that complicated too. The Sudafed was the hard thing to get, and that's why they controlled it. All the other stuff was chemicals you could get. You go to the hardware store and get them, that type of stuff. And if you knew what you're doing, it was very explosive. So you had to know, because a lot of times these speed factories were in somebody's kitchen, and if the fumes would be, if they weren't careful with the flame, every so often you'll see one of those blow up. So you could now, and I used to use, in an allergy pill I used to use, now I do just use the Zyrtec without any other stuff in it. I'd have to go, oh, we need your driver's license. I mean, I'm buying, a pack of tablets every month. Nobody was knocking at my door. But they had to record that. Pharmacies did for their records. And this is one of the early blood pressure treatments, propanolol. We don't use a lot of beta blockers today unless it has changed because they had a lot of side effects associated with them. Originally, they didn't think they did, but this was an early treatment to lower your heart rate. But the trouble is, I think it caused a lot of urinary related problems and things like that. There are a lot of genitourinary problems that were associated with it. So I don't know if that's still the pharmacology, but look at that stuff. And so most organs have dual innervation. Big deal. Okay. Very, very precisely sympathetic and parasympathetic tone. They're always active together. The closest thing to having only one active, again, is fight or flight. So you one division, like right now, you're parasympathetic. maybe not so much mine because I'm more active, but they tend to cooperate. Yours, right now, you're parasympathetic. This is the whole idea of this dynamic antagonism, the term I like so much. Keep getting these emails. The sympathetic division, heart rate, respiratory, slows down digestion, genitourinary elimination, bowel movements, urinating, etc. Parasympathetic division slows down the heart rate, slows down respiration, and again, rest and digest. This is action, this is rest and digest. The big exception again, blood vessels. Nearly every blood vessel, smooth muscle is all sympathetic. So that's blood pressure, even at rest. It's what redistributes the blood for fight or flight. It what makes the kidney work. I talked about that before. It's so terribly important. That's the unique. When you study blood pressure next term, the bottom number, let's say 120/80 is everybody is a classic normal. Okay, that bottom number is what we look at. That's the resting tension in the blood vessel. They're flexible tubes. If they're nice and soft and flexible, the blood flows really nice. If they're too taut, the heart has to work extra hard to push the blood through. The heart enlarges, and finally it gets so muscular it's inefficient pumping. It's not like, the heart getting muscle bound is not a good thing. A little bit is good. Overkill is not. Right? We're good? So sympathetic tone is called vasomotor tone. The blood vessels, other than when somebody's in shock or dying, basically are going to lose that. So that's the bottom number that I was talking about. The 5 blood, and it's always adjusted. If it starts to drop, they fire more. If it starts to rise, they fire less. And then it has the capacity, as you saw, by different types of receptors, where to go. Hold on. Wait. Sorry, guys. So here we go. All of those types. The sympathetic division overrides these effects during times of stress, and then drugs that block the parasympathetic response. And this is what I was talking about before: heart rate and fecal and urinary retention. That's why we're pretty careful with some of these. So that now pharmacology is improved. For instance, the blood pressure pills that I take, that most people take, don't work on this system. They work differently. I take that you're going to learn about. It's called the smooth muscle relaxer, calcium channel blocker, and the other one involves a pathway with that stuff called renin I talked about. Those are better ways to treat it with less side effects. Okay, and this is the best. This is the whole idea. Parasympathetic, when you're talking about the control of the external genitalia, sexual arousal is controlled by the parasympathetic system. Vasodilation dilates the blood vessels to the genital, in this case, the genital portion of the genitourinary. Erection of penis and clitoris. The sympathetic fibers lead to climax or orgasm and ejaculation, depending whether we're talking about the female or the male. Okay. Same thing here. This is the unique role: thermoregulatory responses, dilating the skin blood vessels, allowing heat to escape, and activating sweat glands. That's another one. Again, it's redirecting heat. The only place where it really directs is to the outer aspect of the skin. It takes away most of the blood vessels to right under the skin, sort of the subcutaneous, but right at the skin level, it's able to, there has to be blood flow there to activate the sweat glands and reduce, and basically perspiration evaporating is what dissipates heat. Okay? And the same when it's cold, your fingers get sort of pale, all that blood flow right under the skin is going away, nails, etc. Another one, where you'll get to this with kidney, renin. Okay, and basically what it does: metabolic effects, increase blood glucose, emergency fuel, fats for fuel. That's why we try to mimic it. That's why they use sympathomimetic drugs like diet pills, and that's what amphetamines are, basically, because your body would be firing so fast, it would start to use fat as fuel. And by the way, it killed appetite. And originally, all of these things that came from that Chinese tea were all the ephedrine-based products that became amphetamines, were all for respiratory. Oh, you breathe better. People when they're sick or have bronchitis, it was very useful. Then they found out things like it curtailed appetite and it stimulated your mind. And so they made these and they became a problem without a prescription, might I add. And they made them very popular. And they were used extensively in wartime because pilots flying sorties, I mean, they'd be popping these pills like crazy. That's the way they kept them awake. Nothing unusual about that. This was done. It was done in World War II. It was done in Korea. I think it was done in Vietnam as well. My wife and I, our closest friend, is a disabled Vietnam vet. He can't talk too much about what went on there, but he talks a little bit about stuff. And they're giving these guys pills to keep them going. So everything was a mess. It was there. So parasympathetic division, because acetylcholine is destroyed so fast, relatively quick. Sympathetic division, longer. It's just inactivated. And that's really the difference. That's why that adrenal medulla I talked about, that's that prolonged feeling. Your heart rate takes a while to calm down, etc., etc. And this just summarizes everything on the parasympathetic versus the sympathetic nervous system. And so that, and I would urge you to look at that just to remind yourself, particularly here, about fight or flight. Know the big ones that I've emphasized multiple times. This is something we see in diabetics. That's there. I really would save most of it. I'm not going to ask you about it on the test or anything like that. It's a big problem. About between 1/3 to 1/2 of my diabetic patients, and nearly 3/4 of my patients were diabetics, had what was called peripheral neuropathy. I talked about it a little before. When you lose the sensors in your feet, what happens is it affects both motor and sensory areas. It has to do with blood flow. Sexual dysfunction early onset in men is a significant problem. All of these things. They get what's called orthostatic hypotension. You'll hear more about that. They get up too fast. As you get older, this happens. When I get up out of bed in the morning, I mean, I don't just jump up like you typically, oh, I'm running behind. I better jump up and, get ready for work or get ready to go to school. Generally, you sit up, you kind of, okay, stand up, make sure you like hold on to the nightstand just in case, because you can get dizzy. It happens with everybody. It's not that unusual for people who are not in their 60s, but certainly in their 70s and 80s. They have to be very careful with that. So it's not so much a neuropathy as it has to do with just the way your system processes. This comes on early. So all of these things, and I know a lot about diabetes, and hopefully whoever teaches you AP2 gives you chapter and verse. But the best way to address these things is to keep them from happening, and that's early aggressive control. I mean, best way to keep it is diabetics, once they find out they're diabetics, whether it's insulin or medication, diet, exercise, get the whole family involved. That's not me. That's someplace in Boston that made themselves very famous, the most famous diabetic treatment program in the world, treating program in the world, called the Joslin Center in Boston. They did this. There's a lot of Joslin certified diabetologists. They follow this. It's really significant. And not a whole lot. Limbic system can play a role. Not a whole lot here. I mean, we covered most of these, all these different things. Hypothalamus plays a role. Limbic system plays a role. I'm not getting into biofeedback. Okay, the big disorder of this probably is high blood pressure. And when we don't know why, a lot of people, when they talk about what's called primary hypertension or high blood pressure, typically it's something we don't know what it is. A lot of it is lifestyle, and a lot of it is heredity, and a lot of it is factors we don't know why people get them. Okay, some people, they are just have this, and sometimes it comes at certain times. The heart works harder. Okay, and this is So a lot of times they'll use these. Again, there's better ways to treat it now than there were years ago. There's been a lot of change over the last 50 years. Yeah, and really the way when you learn about in the unit on AP2 on the blood vessels, you talk more about this and hear more about it. Is understanding a lot of it. Hey, I heard the same thing from my doctor forever, particularly when I was a smoker. I used to joke about it. Yeah, here's my copay: lose weight, stop smoking. See you later. And she'd look at me, my doctor, for most of those times, the lady, she goes, Lou, stop. I have to give you a checkup. And lastly, this is something you only see in people with spinal cord injuries. A comment about this Raynaud's. Last thing to talk about. Raynaud's is a funny disease because it really causes spasms. We don't understand why. Some people, when they get excited, a lot of times to cold. Okay. Sometimes it's an underlying disease that's part of your immune system. And so what happens, your fingers actually do this. My first wife had this, and it was just a cold more than anything else. She'd get in the pool, even on a warm day, the sudden temperature change, her normal skin color, she'd come out, and all of a sudden, and it's the same on both sides, we call it bilateral and symmetrical, they'd start to blanch or go white. And then, because the vessels went into spasm, when the spasm was short lived and when it released, all of a sudden, he's got sort of a bluish color. And so we call it the patriotic disease, red, white, and blue. So it went from normal skin tone to pallor, and the other one had sort of a bluish color. In the old days, you probably say cyanotic, but that's a little more ominous. Okay, it's almost like the blood was so engorged when the spasm was released that it couldn't get back out of the fingers. Might be a better way to do that. I think that's everything. Yep, it's everything. Okay, we're good. Amazing. So again, Monday I'll be here, and again, it's optional for everybody who's going to be here.